discussion on addiction and substance abuse, a critical issue affecting individual, families and community worldwide, crossing over age, gender and socio-economic status. Addiction, whether it is of a substance like alcohol, drugs or behavior habit, has far-reach consequences. Addiction not only suffers for a personal reasons, but it demands high level of awareness, understanding and collective actions. So today we have some extreme guests with us who are MSc Nursing students doing their specialty in mental health nursing. They are from M.Sc Shikshan Sanstha, Sitabai Nargulkar College of Nursing, Nagpur, and they are present here to share their insight with us on this topic. Today we will discuss about what are the treatment, prevention, rehabilitation and role of communities and families in recovering from addiction and substance abuse. Our main aim for discussing this is to break down the stigma on addiction and to bring out the practical solution to reduce this critical issue. So we all have a basic knowledge regarding what addiction is and what are the symptoms is being shown by the addicted person. But I would like to ask Ms. Vandana, can you please tell me how do you explain the addiction and what are the warning signs we can see in patient with addiction?
Yes, nowadays everyone is talking about the addiction. What is the exact addiction? So this is the very important nowadays. Everyone should be know what is the exact addiction and what is the substance use. Yes, addiction is nothing that it is a strong physical and psychological use or urge to having something that is dependent on something. Like in that include it is not only the I think it will be include some substances and activities also. Even that people is also know what is the consequence of that using of substances, that is addiction. Still they have a urge to do that, and it is having impact on their daily life and it is harmful for their activities also. So if we talk about their early warning sign about the addictions, so in that include the emotional and behavioral sign, then physical sign also included and psychological also. If we are talking about the emotional and behavioral sign, so in that include the negligence towards the family members, their neighbors, their friends. In that they are the negligence toward the relations. Then if you are talking second point, in that the secretive and suspicious behavior. So in that if they are taking any substance, continuously they are having drinking, their addiction of alcohol, so they were having a suspicious behavior towards the family and their family members, their friends, even their working places also. They should not get easily confidence to talk with people, and they always having a suspicious anyone can be harmed to them. And it is also leads to the trouble also. Sometimes addiction, continuing use of drinking, the violent behavior include. So they may be leads to the legal process and legal troubles. Then episodes of drinking, continue urge to drink the alcohol, continue use of substances, anything. It can be cannabis use, it can be include, any drugs also include. They have a continuous urge to take that drug or alcohol, and episodes are continuously including. Then as I said, negligence in the family, so continuous conflict also including in the family members and colleagues in their workplaces. They are not easily take confidence and having the conflict between them. Then in physiological, yes, as well as in emotional conflict, like physical signs also include. In that people's size is changes in the people's size, then bloodshot eyes, changes in the appetite, in sleeping patterns is disturbed. So these are the physical signs. And if you are talking about the psychological warning signs, in that include a disturbed sleep, yes, then hopelessness, suicidal thought also included, then depression also included. So these are all are included in a psychological warning sign. So I think it will be a main warning signs that day-to-day life we can see in addictions or substance use people.
Indeed, that was true. that whatever you explain and what are the early warning signs you have been listed, by that we can easily diagnose or identify the patient who are having addiction. So it will really beneficial. But there are various misconceptions which has been going on in our communities, right? So we should also know what misconception is going in this community. So for this I will like to ask Ms. Muskan to please state the common misconceptions.
So as you said, there are many misconceptions present in our society, and it is our human responsibility or a citizen's responsibility to understand those misconceptions and come forward and change them. The most common one is that addiction is a choice. It is often said that the person who is having the addiction or who uses substance on a daily basis, they have a choice to use that, or they lack the willpower to quit addiction. But that is not the case. Addiction is a complex brain condition that is determined by the genetic factors, environmental factors and mental health conditions. So it is not an individual's choice to be addicted to any substances. Also, it is seen that people often say that the prescribed drugs are not dangerous enough to be addictive, but that is not it. The prescribed drugs are also addictive, and that can cause substance abuse if used over counter. Right, so it is our responsibility or doctor's responsibility or even the person's responsibility to take into consideration what doses are prescribed and how it should be used, and recognize such conditions. Like some drugs are like painkillers, sedatives, can lead to addiction. People also say that one-time use of any drug can lead to addiction, but that is not the case. Indeed, some drugs are very much addictive, but regular use of such drugs causes psychological dependence on these drugs. That leads to addiction. Also, addicts are easily to identify. We often listen to people, they say that yeah, we can see that he's or she's an addict, but it is not. They often feel that people who look unhealthy or people who belong to some social classes are addicts, but that is not the case. Addiction can be found in from people from any background, and people may look healthy, but different types of addiction are present in those people. Also, if it is said that after rehabilitation the person will be addiction will be reduced or it is completely gone, but that is not the case, because how much the person is dependent on psychologically on that drug, it causes withdrawals, and that also leads to relapse of the condition, and the person will get again addicted to the substances. So we have to understand this misconception that are present for a proper support system can be developed in our society. So that
Positively, the point noted by Muskan was like your doctors prescribe some drugs for you for small period of time or short period of time, and after that period of time you start taking it without prescription, and that can lead to addiction, right? And that addiction many times what happens ki it goes towards higher level and it affect you, right? But that affection not only affect the individual but community and families also. So how does addiction affect not just the individual but also their families and community? I would like to ask Ms. Dhanashri about it.
You rightly said that it does not only affect the individual only. It is just not the individual struggle. The families are the silent victims of this addiction, and in turn it will affect the community. If suppose there is addict in a family, the whole family is affected. If parents are seeing their son or daughters falling prey to this, then if spouse is there, he or she will feel emotionally and financially drained. We have seen the movie Udta Punjab. In that they have shown how a boy in a family is affected, and then how the whole family is affected by the whole thing. Then the singer and how their lives are intermingled in a community, and so how the community in turn gets affected because of this. And in community, not only the families are affected, we have lots of burden because of this, because the crime rates are high due to the addiction in our community. And in turn, in India we spend near about 2 lakh crore per year due to this addiction. Our rehabilitation centers are overburdened. Then our security services, they are also overburdened because of the high crime rates. So it does not. It is just not only the individual struggle. The families are the silent victims of this. In turn, then the community, and as of this, the whole nation affects due to it affects our public health as well as it takes economical burden on our nation. So it affects whole community.
Just as the example was correct, and as we have seen Kabir Singh movie also, there are various factors which contribute towards the addiction, right? In a Kabir Singh movie, when the hero was having breakup with her girlfriend and then he get addicted to alcohol, cigarettes and all the things, right? So there are various contributing factors which directly contribute in the condition. So Miss Shubhangi, can you please tell us what are the contributing factors which creates addiction and substance abuse?
Yes, thank you Rupali. There is various factor influencing. We discuss one by one. The first factor is family and the environment. In the environment, in family, their parental use of drug or alcohol like influencing child again in good childhood life substance abuse. And then second is the peer group. The friends who abuse substance can like person likelihood of substance abuse. And then third is socio-economic status, and the socio-economic status, low socio-economic status can risk. The factor is substance abuse. And the second factor is mental disorder. In mental people with mental disorders, anxiety, depression may be substance abuse from self-medication. And the second is personality characteristics. Low self-esteem, low self-confidence be associated with substance abuse.
Truly stated, Shubhangi ma'am, the contributing factors truly affect the addiction and substance abuse, but the commonly seen factor has been peer pressure. When students goes to college and just to make friends and a big group, popular group in the colleges, they usually accept all the orders given in the groups, right? And they follow it, and which directly affects the students to take an addiction or to take the things they don't want to take, right? So next I would like to ask Ms. Shubhangi that how does peer pressure influence substance abuse among teenagers and young adults?
Yes, exactly. Peer pressure is more powerful force, social force, in that adolescent and young adults often feel to fit in their peer pressure, peer with their peers. Okay, in that the persons or our friends who are the people around us, they are influencing us to take the decisions. Okay, in that the peer pressure is also good way or in the negative way also. Good way means peer are to take the decisions in a good way, that healthy habits and all that, and in negative way they are influencing you to take the that negative things and negative experiences. In that for teenagers and young adults, fitting in with the group is very important. If the friends are drinking, taking alcohol and a substance, they may feel pressure to do the same, just to acceptance, means the peer group acceptance or to stay with the group. Okay, in that once they start the take any alcohol substance, and that it's hard to stop for any addictions. Okay, that may lead to the addictions. In that continue using substance to stay part of the group, which can lead to addictions, health problems and decline in the education. Means we are discussing about the adolescent and the young teenagers. Okay, in that they decline in the academic sessions, that may include. And the main point is that the social media is also influencing the persons or teenagers, young adults. In that celebrities and any influencer, they are taking alcohol, drinking, abusing substances, that will lead to the peer group to take that substance or alcohol and habit. Okay, in that the best way to resist the negative peer pressure is to confident. We have to teach the student or adolescent or our child and friend
that we have to be confident, then we have to keep our self boundaries and choose friends who are accept our boundaries and accept our respects and choices. That and talking to the parents, then mentors and teachers to can also help teens make the smart decision. Means we have to take the help from our parents, then friends and the mentors, teachers, so we can de-addicted from that substances and drinking habits and all that.
It was true that to just adjust in the group, students start getting having addictions. But the addiction not only affect their mental issue, not only create mental issues, but they also create medical issues for them. So people who are chronic alcoholic, they usually suffer from cirrhosis of liver, and many times it results in mental disorders also. So Miss Vandana, I would like to ask you, is addiction more a psychological issue or a medical condition?
Yes, it is a very good question. Everyone is asking about the addiction, but it is not everyone know if it is a medical condition or it is a psychological condition. But it is definitely it is a medical condition, because addiction it is a strongly affect the brain condition or brain functions. Whatever brain circuit is there, that may be addiction or any substance that is continuously used, that is continuously persons depend on that. So that is definitely affect the brain functions of the person. So it is definitely it is a medical condition that is leads to the psychological issues that will affect to their day-to-day life, their psychological conditions, their psychological way, that will be included here. So it is definitely medical condition that will be leads to the psychological issues. If medical condition, that is affect to the brain function, and if you are talking about the psychological conditions, that is include the like a negligence of friends, avoidance of the friends circles, avoidance to talking with the friends. If that time person have interest that activities, but due to the addictions or due to the some substances, they are not interest in that activities. That is the avoidance. Yes. Then second one is the persons is having continuously urge to do that things. If they are having know that it will be harm to their health, but they are urge to the take that substance or continuously drinking to the alcohol. So definitely it is a medical condition that as well as psychological issues also.
Yes, Ms. Vandana, you rightly told about this psychological issue and medical condition. But people who create now with the addiction, they started going towards the medical condition. Their brain and body is really affected, right? So Ms. Kanchan, can you please tell me what are the impacts of addiction and substance abuse on body and brain?
Yes, there are various impacts on body, or including mental health or brain also. Long-term substance used mostly affective brain, including chemistry change in brain or decision-making changes, orientation, concentration changes, or mental health also affect, and can cause long-term cognitive or emotional issues also. Physically, it damages various organs like liver, lungs, heart, or weaken immune system also, and increase risk of chronic diseases. The body also depends on substance, leading severe withdrawal symptoms like hand shivering or other symptoms, vomiting. Ultimately, prolonged abuse can cause lasting, sometimes irreversible damage of both mental and physical health. Mental illness including anxiety, depression commonly seen. In my posting, mental health posting, I seen one patient. He is using cannabis last 10 years, and final diagnosis is mania. So all the substance are affecting all body and mind.
That was true, but as we have seen that we talked about psychological issue also. So the people who are addicted or chronic substance abused persons, they also suffer from psychological disorders such as mania, schizophrenia. But most commonly we see addicted person suffers from depression and anxiety, right? So Ms. Muskan, can you tell me what is the relationship between addiction and psychological issues like depression and anxiety?
As Ms. Kanchan said that she saw a patient with addiction and the final diagnosis was mania. So that occurs, and you said we see commonly people having addiction and depression and anxiety. So both of these conditions, that is addiction and depression and anxiety, are co-occurring diseases. It is also, when both of them occur together, we call it co-occurring diagnosis or dual diagnosis. It is due to because people do self-medication to release the pain. If a person is sad or in pain, so they will take medications, and that medication will cause addiction if taken more than required. With patient with anxiety, take antidepressant drugs or anti-anxiolytic drugs, so that depresses their mental state, and that is similar to what the drugs do. So instead of, because they do not get prescribed drugs to get anxiety, reduce anxiety, so they take drugs or substances that replicates the action of the anti-anxiolytic drugs, right? So both these conditions are related to each other. So people with depression and anxiety may lead to substance abuse because they take the support of substances present freely in our society to reduce that anxiety and come over depression. They will not come over depression because both these conditions have similar brain chemistry. Both of them affect the neurotransmitters of our brain, that is serotonin and dopamine. So that is also a relation where we find that people with substance abuse have anxiety and depression. They also have similar risk factors because socioeconomic status, genetic factors, if hereditary factors, that may lead to both of these conditions. And if both conditions are present all together or simultaneously, the condition worsens of the client because there are more symptoms seen, because already the patient is depressed, they are taking drugs, they are using substances, and they may further have deeper depression or more anxiety is seen. Treatment also plays a very important role in this. It is a challenging treatment because when treating such conditions, we have to keep in mind that the person is having two conditions, that is substance abuse and depression. Withdrawals will be seen in patients, and to cure the substance abuse or the depression, we have to deal with the underlying cause that may have caused the anxiety. That could be due to past trauma or any other thing, environmental factors. So we have to keep in mind and treat it accordingly like that with the help of medication as well as therapies. So to understand both these conditions, we have to reconnect them and then think of a treatment according to person.
Stated Ms. Muskan that people who are suffering from depression and anxiety, to reduce their depression and anxiety, they started using a substance for it, and it goes vice versa. Like if people is already chronic alcoholic, he can also land up in depression and anxiety. Various people use various substances as an addiction, so and they harm it in different way at different period of time. So Ms. Dhanashri, can you tell me, can certain substance be more addictive and harmful than other?
That all the addictive substances are harmful to anybody, but the substances that we already discussed, they hijack our brain reward system and alters brain chemistry. Some substances have more addictive potential, they have more dangerous health risk, so some substances are more harmful than others. In India, most concerning one is alcohol, because we have 1 in 5 hospital admissions are because of alcohol, and 1/3 of all the domestic violence cases are because of alcohol, and we have also 2.5 lakh deaths annually because of alcohol only. And then the second one are opioids like heroin and fentanyl. India is a major transit route for the heroin trafficking. Fentanyl is a 50 times more potent than heroin, and the overdose deaths are increasing nowadays. Then there are synthetic drugs like methamphetamine and MDMA. They are used in the party culture, and they cause violent behavior and mental health disorders. Then is cannabis. Cannabis, we thought it as a harmless drug, but excessive cannabis use has been linked to schizophrenia and the mental decline or cognitive decline. Then tobacco and nicotine. India is the second largest number of tobacco users in all over the world, and with over 1 million tobacco related deaths are occurring in our country. So we can say that the most dangerous drugs are those which are widely available, easily available to all of the addictive, and then they have a major health risk. So that substances are more dangerous.
Due to easy availability of things and easy availability of substances is resulting in increasing the cases of addiction and substance abuse. As our technology has been improving and we are having a developing country, there is various effective treatment which can treat the addiction, right? Please tell me what are the effective treatments for it.
Yes, there is a no effect, exact treatment is not there, but addiction is a very complex condition. In that we can treat successfully by the right methods, that therapy, medications and rehabilitation program and lifestyle changes. In that therapy we can apply the cognitive behavioral therapy and motivational interviewing. In that we individual understand their triggers, means why they are doing this and why they are going to addicted. In that and developing coping strategy we have to develop and change negative thinking pattern of the people and adolescent and teenage. And then group therapy and family therapy also provide support and motivation. And the second one thing is the medication. In that methadone and the buprenorphine is the useful drug by helping people recovering from opioid addiction, while naltrexone is helpful to relapse the blocking the effect of drug and alcohol. Medications of mental health conditions like depression, we can give the antidepressant. And that after that the rehabilitation program. In that we have to, if patient is mostly addicted, too much addicted, we have to keep the patient, we have keep the people in patient rehab, requires individual to stay and treatment facility and supervision, closely supervision. And outpatient rehab, we have to take care of people and person and adolescent in the home, and we have to take care of them. In that this program teach relapse prevention techniques and life skills. And the other thing is lifestyle changes. In that we have to tell them the exercise, develop exercise, stress management, then mindfulness techniques and then healthy habits, healthy eating habits. In that we have to teach them. Activities like yoga, meditation, art therapy also helpful to manage the emotions and the reduce cravings. Okay. Then dual diagnosis treatment. In that we have to treat the people and adolescent with addiction also and mental disorder. Okay. And after that this treatment part is different, but we have to take this follow is most important. Means we have to take care of after that relapse prevention करने के लिए relapse prevention होने के लिए. Recovery doesn't end after treatment. Long term support, follow up therapy, regular checkups, healthcare providers help prevent relapse and maintain sober life. Okay, that's the treatment of the addiction.
Absolutely, this treatment can definitely help our patients who are addicted and having suffering from substance abuse, as they got admitted in the de-addiction center, but after discharging from de-addiction center they restart their addictions, right? So they definitely follow-up is very important for this. But as we see that these conditions is commonly seen in teenagers, right? In school, the students who are in colleges and schools. So I think our colleges and institutes should also do something to reduce these cases, right? So Ms. Shubhangi Timbune ma'am, can you please tell me that what strategies can school and colleges use to reduce these cases?
Yes. There are various strategies to colleges are doing. The first is social resistance skill training. So in that teach the student to how identify the peers to pressures to us to substance abuse, And the second is they are developing the positive coping mechanism skills and increase the goal setting and managing the emotions. And then second is the peer leadership qualities and programs. We provide the peers leadership and substance abuse can behave among their peers. And the third is the family engagement, the parent education workshop. The parent education provide information about substance abuse and prevent the strategy to communicate effectively with their children.
This kind of strategies is being used by school and colleges. Definitely we can help in reducing the cases, and I think all colleges should contribute or should have a communities, specific communities for these conditions, so that we can improve our upcoming generation. But this is all about the colleges and institutes which are developing the strategies to reduce the cases. But what about public, right? Public should also have awareness that what implications they can do to reduce these cases, as we are wherever we are living, as if we can see in our surrounding, if people is suffering from addiction or they are getting in their early stage of addiction, so we can help them by contributing somehow, right? So Ms. Kanchan, can you please tell me what are the general public contributions should be there to reduce this?
Medicine and therapy is used to reduce substance use, but general public can play a vital role in addiction and support to recovery by raising awareness to reduce stigma, discrimination, and supporting recovery programs through donation and voluntary creating inclusive environments, advocating for better addiction treatment policies, engaging in community initiatives, encouraging policies and encouraging open, empathetic conversations, and providing resources for families for those affected. These collective efforts can reduce the substance abuse cases and make a recovery more accessible or effective.
Ms. Kanchan, that if people get proper resources, so they can also help in recovery of a patient suffering from substance abuse. So as today we discussed various things, what exactly the addiction was, what are the warning signs of addictions, how they impact our body and brain, what are the contributing factors like peer pressure, environment, family pressure, stress directly contribute towards the addiction, and how can school and colleges and peer communities or peoples can help in reducing these conditions. Really a critical and serious issue, and with education, support and right implementations we can reduce these cases. So together we can break the stigma and bring a difference. So let's create a healthier society by contributing towards the addiction and substance.